Hello, Yildiz Sethi here of Rapid Core Healing. I'm going to be talking to you a little bit here about depression, because depression is a really widely known and experienced condition for many people. And there are quite a few ways of working with it. I would like to talk to you a little bit about what depression is, and possible ways of treating it that are more effective than perhaps what we've been doing until now. I'm going to be showing a PowerPoint presentation, so bear with me while I put it up. Okay, so we're looking at depression and the underlying dynamics. Now, what is depression? This is quite a difficult question to answer, and probably the medical model itself will have pretty hard time to define what it is. Normally, people will go on the DSM-5 and do a checklist and say, yes, it sounds like you have depression, and then we go from there. So depression can be caused by many things. One way of considering it is possibly brain injury of some sort or a disability. Another way of thinking of it is a hormonal or chemistry imbalance that puts people in a particular mood state that they find hard to shake off. And probably the third one that I probably focus on more than any other is the coping mechanism. Depression is a coping mechanism. A coping mechanism to cope with whatever the person is experiencing in their life. Now, the hormonal and chemistry imbalance, yes, it's probably true to some extent. Probably even to a large extent, but I also find now that with neuroscience and with the latest innovations in other ways of thinking, that this may also be able to be changed. It might not necessarily be hardwired. So I'm going to be looking primarily at the coping mechanism, even though I know there are a proportion of people that will have actual brain injury, be affected by disabilities of some sort, and so they have depression, which I must admit I cannot help. I cannot treat. And so in those cases, definitely working with management of symptoms, with medication and with other ways is absolutely the way to go. However, my belief is, and my experience over 20 years of clients is, that most of the people who present with depression are actually presenting with a coping mechanism of depression, which is very, very much treatable. So what causes and sustains depression? Well, as I've mentioned here, injury, physical malfunction, disability, definitely. Also beliefs. Yes, if you have a belief that is telling you that things need to be this way, or people need to behave that way, or your life needs to go a particular direction or in a particular way, and it's not, then yes, you might well end up being fairly disappointed, angry, and depressed. So working with beliefs is obviously a good way to go. Unable to get over shocks, disappointments, or trauma is another way. So often we all go through what I would say is normal depression. That means that at certain points of life, big changes in life, things that don't work out, grief, disappointments, even injustice to some extent, we will go through a time when we kind of withdraw while we have to get our head around, or our heart around, what has just happened, assimilate it, and then we come out again. That's what I call normal depression. And that's something that we as resilient human beings can kind of get over by ourselves. However, if we can't, we might seek the help of somebody like yourself if you're a practitioner, or somebody like me. So, unable to get over shocks, disappointments, or trauma might lead to a state of depression. Feeling unloved, definitely. Having so low self worth or worthlessness, definitely. Helplessness, hopelessness, feeling like a victim, all of these things can lead to a state of depression. So, where does it come from? Is it nature or nurture? Are you born with it? In other words, is it coming to you with your DNA through your family tree in some way? Well, yes, it can. There are definitely many cases of whole families suffering with particular mental health illnesses, and in particular depression. And so, yes, if you come from a family that suffers with depression, definitely you can be born with it, so to speak. Now, is it coming to you because you are in a family who are depressed and therefore you copy or mimic the depressive state of your parents? Or is it coming on a more energetic level, coming through your DNA or with your DNA, as the epigenetics may suggest as well? So, yes, it is possible to be born with a depression. Or did it come from a life event or situation or trauma? Definitely. You can get depression from, as I mentioned before, from something that you haven't been able to process, something you haven't been able to let go of or assimilate in some way, or a trauma that stayed with you. Definitely. So either of those you can get depression from, and both of them, from my perspective, are treatable. Is it relational? That's a third one. By this, I'm speaking in particular about John Bowlby's idea of attachment theory. If you have a parent or a family that are very distant, disconnected, are not demonstrative, don't hug, touch, cuddle you as a baby, it could well be that you are growing up feeling disconnected, perhaps not so loved or worthy. And that can certainly lead to depression and is treatable. How to treat it? Can we treat it, or do we have to manage it? Now, if you are involved in the medical model, there is a belief in the medical model that you are probably one of those people that have a defect in your brain or your wiring or your chemistry that can't be changed and therefore has to be managed with medication or CBT or anything like that. And you will probably have it for life. My argument here is that only a few people fall into that category, and most of the others are treatable to a large extent. So there are many ways that depression is being treated right now. Obviously, counseling of many different types, CBT, part of that medical model with medication, hypnotherapy may be appropriate, creative therapies may well be appropriate. Long-term psychotherapies are often used for depression. Now, if you get good results from any of those, fantastic. But in my experience, in my practice over 20 years, I have come across many people that have done all or many of those different ways of trying to treat depression and still have it. But if they're treated in a different way than those ways, can actually come out of depression fairly quickly and permanently. Okay. So definitely all of them do have a possibility of a treatment. I guess my point is, how long does it take? How effective is the treatment? Does it get to the core of the problem? Is it just the connection that happens within the psychotherapeutic process that helps them to get over depression? If so, that's great, that's fantastic. If all of those ideas do not work, then we need to go to another approach. Now, rapid core healing is a new approach. I am the founder of rapid core healing. And from a rapid core healing perspective, I see depression as an emotional mind state. Now, either an emotional mind state or from coming from your family of origin. So, and either one of those, whether it's from an emotional mind state coming from a situation, a disappointment, a trauma, a belief even that you've developed in your present life, or coming in through your family system, both of those are treatable with rapid core healing if you don't have a brain injury or you're not part of the extreme ends of the DSM-5, perhaps suffering psychosis, bipolar, schizophrenia, etc. Now, when I use rapid core healing, I don't assume to know, just having seen you in the first session or on an interview or a phone conversation, exactly where your depression came from. And so I will actually trust the process of rapid core healing to do that. The word rapid core healing is quick, usually 3 to 5 sessions for most of the people I see. It goes to the core event that started with the coping mechanism of depression. And that could be a trauma, a disappointment, a belief system, or it could be something to do, something that you've carried from your family of origin, or something to do with the nature of how you attach to your family, particularly through your formative years. Now, the main thing is here that if you come to me for rapid core healing, I would also be looking to see, is there a reason why you need to remain with your depression? Okay, that seems like a strange thing. In other words, is there a secondary gain to you having depression? Many people who have been diagnosed with depression will say, look, I can't work, I need to be on benefits. You have to treat me very kindly because I'm rather fragile. I can't really do relationships that well, or people have to carry me emotionally or make excuses for me all the time. So is there a secondary gain to maintaining that particular depression? And so I particularly like to look at the readiness for change. Is there a readiness to come out of depression? Because from a rapid core healing perspective, I don't work with people unless they're absolutely ready for change. And I do charge a reasonable fee. And generally speaking, if people are willing to pay that fee, that usually tells me that they're absolutely ready for change. It could be a problem if you work for a charity or a free organization, because many people will go onto those programs who are actually not really ready for change, just going through the motions of saying, yes, I'll turn up to sessions, I'll tick a few boxes here, but actually I don't really want to change. It's not really my agenda. So readiness for change is incredibly important. So rapid core healing techniques rely on the fact that the mind and the body knows where this particular depressive mind state started. Whether it started in the unconscious mind, the transgenerational mind and body, because they will be imprinted in a knowing of where it started. Now you might say, how on earth do we get to know where that started? Well, with rapid core healing techniques, you will be able to facilitate going to the core of when it started. The process will provide healing pathways to their solutions, the client or the patient's solutions, because the process of rapid core healing is not about me as a practitioner going and making them come out of depression. They've already got to want to come out of depression. Remember the readiness? And once they're ready to come out of depression, they will be really open to meeting me halfway and taking part in the process, because this is a client-centered process that is adapted to their needs. So the process will show them or guide them through healing pathways to their solutions, which is a self-healing process on the part of the client. They have to be willing and eager to do it, to come out of depression. It works with the personal and the generational, systemic, or both, for a resolution of depression. And it completes with an integration process as well. Now, rapid core healing is informed by neuroscience, epigenetics, the best from the past and the present innovations, including trauma. Not only is it trauma informed, it's trauma skilled in knowing what to do when people are in a traumatic state. It's not just about being informed about it, it's giving you the skills to work with it really effectively. So rapid core healing, new solutions, is a new approach to professional development and training to improve your ability to make a difference, improve your career or your business. So that's a really short rundown of rapid core healing for depression. Please look at my website, rapidcorehealing.com. Go to the training part of that website and look at the free gifts. There are other videos there and lots of articles and lots of information if that's what you're looking for. So please, hopefully, look at my website, and if you are wanting to become a practitioner, you're very welcome to come on board. Whether you're already a practitioner of one sort or another, this can certainly turn around the way you work with clients. Or if you're a brand new practitioner and would prefer to take this pathway to start your own practice, rapid core healing is for both. So hopefully see you soon.